patient Sembrano?
Yes, ma'am.
Hi ma'am, good morning. My name is Nikila Reyes and I'm going to be Radtech for today. Ma'am, pa-confirm ko, can I have your full name?
I am Zyril Marie R. Sembrano po, ma'am.
Okay. So, yes, Miss Sembrano, ano pong preference language natin para mas madali, hindi kayo may harapan po?
Pwede man kahit Tagalog, Bisaya, or English po.
Okay, ma'am. So, ma'am, i-verify ko lang, ma'am, ha? Kung sa'yo, middle name po ninyo?
Reyes, ma'am.
Okay. Ang birthday po?
March 8, 2000 po.
Okay. And ilang taon na po si Miss Sembrano?
21, ma'am.
Okay. So, ma'am, kailan yung last menstruation niyo po?
Mga last 3 to 4 days pa nata, ma'am.
Okay, ma'am. Meron po ba kayong mga past na experience na na-x-ray po kayo within this year?
Wala, ma'am. Mga
Okay.
last 2 years pa nata.
Okay. Sige po, ma'am. Thank you, ma'am, sa information nyo. So, ngayon po, lahat na verify ko na. Ma'am, pwede kong makuha yung request ni Doc po?
Ay, kani ba to siya, ma'am?
Kana, ma'am. Sige. So, yes, ma'am. Unsa di ay ang nahitabo, ma'am? Ano
Ay.
po nangyari?
Nahulog kasi ako sa hagdan, ma'am.
Opo.
Tapos, mga 5 buwan yun, ma'am.
Okay, ma'am.
Pero okay man siya, nagasakit-sakit lang siya, ma'am.
Sige, ma'am. Sige lang, don't worry, ma'am. Na naman diri sa request ni Doc ang procedure na buhatan nato karon. So, ma'am, karon pwede na ka mag-ilisag patient gown dito sa side, and then pa-remove na lang ko sa mga metallic objects sa imuhang body karon, ma'am, ha? Pwede na ka mag-ilis, ma'am. Balik lang diri, ma'am, ha?
Sige, thank you.
Thank you. Okay, ma'am. So, humana ka, ma'am?
Yes, ma'am. Human ako, ma'am.
Okay, sige, ma'am. Lingkod diha. Tapos pwede na ka maghigda, ma'am. Okay, sige, ma'am. So, good morning. We will be conducting an AP projection of the hip right now. So, for the IR size, we will be using a 10 by 12 in a lengthwise position for the central ray. And we will be using grid for this examination because the body part is thick. Also, for the SID, we will be using 40 inches, which is the minimum. And for the shielding, we will be using some gonadal shielding and thyroid shielding for patient's protection. Just make sure that it will not obscure any anatomy of interest. So I will now go ahead and position my patient. So, assuming that the IR is already on the bucket tray, right now I will go ahead and position my patient. So, make sure that the patient is in a supine position and with a pillow for patient comfort, and always ask for patient's permission before touching the patient. So, ma'am, comfortable na ka, ma'am, no? Right now, our patient has already pillow for its comfort, and the patient is already in a supine position. Right now, ask the patient to place its arm on the side or on its chest part. So, ma'am, asa ko comfortable, ma'am? Diha or sa side? Okay, sige, ma'am. So, now that the patient is already in the correct position, we will now proceed with the part position. We have to palpate the femoral neck and make sure that it is aligned to the midline of the table as well as the image receptor that is located on the bucket tray. So, always make sure that no rotation of the pelvis is not visible by keeping equal distance from the axis to the table. So, equal distance from the axis. So, make sure that the femoral neck is aligned with the midline of the table. So, ma'am, okay lang mag-move tagamay diri na side, ma'am? Okay? Okay na ma'am? Sige, ma'am. Okay. So, ma'am, magunit ko, ma'am, ha? Okay. So, after you align the sure that we should rotate the leg internally 15 to 20 degree, but do not try to do so if you have suspected that the patient has a trauma, because maybe it will worsen the situation of the patient. So, mama, kaya man nimo i-rotate internally imong leg, ma'am, no? Kanang pasulod, ma'am. Ato nga. Sige. Okay, kaya man, ma'am, no? Okay. So, ana lang, ma'am, ang position. So, now that the patient is in the correct position, we will now proceed. So, for the central ray, it will be perpendicular to the IR, which will be directed 1 or 2 inches distal to mid-femoral neck. So, that will be 1 to 2 inches distal to femoral neck. Okay? So, dito na part. And then, femoral neck is located about 1 to 2 inches medial to 3 to 4 inches distal to the axis. So again, that will be 1 to 2 inches medial. So, on this part, ma'am, magpalpate ko, ma'am, ha? Okay lang. Okay. So, right now, the central ray again will be perpendicular to IR, which will be directed 1 to 2 inches distal to the mid-femoral neck. So I will now collimate the area of interest. Okay. So, assuming that I have already collimated the area of interest correctly, since the collimation that I have right now cannot be controlled manually, now let's assume that I have collimated it correctly already. So, don't forget to put marker. Just make sure it will not obscure any anatomy of interest. So, right now, the feet of the patient, or the leg of the patient, is on its correct position, which is 15 to 20 degree rotated internally. Okay, so inform the patient to avoid
Unnecessary movement.
during the procedure. So, ma'am, hold your breath. Okay, mag-shoot ako. 1, 2, 3. Shoot. Alright, so the next procedure will be lateral projection of the hip. For the IR, we will be using the same size, in which it will be 10 by 12 lengthwise. And we will using grid for this examination, because we will be examining thick body part. And also, we will using 40 for the SID. That will be the minimum. Don't forget to give your patient gonadal shielding, as well as a thyroid shielding for its protection. I will now proceed on positioning the patient's body. So, right now, we will proceed to the patient's position, but first, let me give or provide the patient a shielding. So, ma'am, maghatag og shielding, ma'am, ha? So, dili na part. And, make sure that the shielding that we will be providing will not obscure any anatomical, anatomy of interest. Also, again, make sure to provide a pillow for the patient's comfort. So, for the patient position, patient will be in a supine position, and with the affected hip area to be aligned to the midline of the table and the IR. So, midline of the table and the IR. So, ask the patient to adjust its body part if it's not placed correctly. So, ma'am, okay lang mag-move ta dito na side. And, ma'am, okay lang mag-unit ko, ma'am? Okay. So, ma'am, pa-adjust lang ko, ma'am. Okay. Sige, ma'am. Okay. So, now that the femur or the femoral neck is already perpendicular to the mid part of the bed. Ask the patient to flex her knees and hip on the different side with the sole of the foot against the opposite leg near the knee if the patient can. So, ma'am, kaya ni mo, ma'am. Buhaton akong ipabuhat sa imo, ma'am, ha? So, ma'am, okay lang i-flex ato ang knees. Ma'am, mabunit ko, ha? Sige, kana, ma'am. Ana. So, ma'am, okay lang kung position nimo siya dire. Kana, kaya lang, ma'am. Dili man ka maglisod, ma'am, no? Okay, so now that the patient is in the correct position, make sure that the patient abduct his leg 45 degree. So right now the patient is in the correct position. As the patient have the shielding, I will now start on the collimation or with the collimation of the anatomical part. Okay, so this is how the patient position should look like. The feet or the knee should be abducted 45 degree. The gonadal shielding is present already, as well as the thyroid shielding. So I will now go ahead and proceed with the collimation of the anatomy of interest. For the central ray, it should be directed to the mid-femoral neck. For the collimation, make sure to closely collimate the four sides of the anatomy of interest and make sure that the marker is in position. So don't forget to place the marker and just make sure that it won't obscure any anatomical parts that is being radiographed. So instruct the patient to avoid any unnecessary movement and hold the breathing to avoid any movement. So ma'am, ay lang taglihok ma'am ha, mag-shoot na ko. 1, 2, 3, shoot. Okay, so ma'am, human natong procedure ma'am, pwede na ka mag-ilis og patient gown ma'am. And balik lang diri ma'am for instruction. Ay ma'am, mana ko ma'am. So, yes ma'am, human na kag-ilis ma'am no. Actually, human na to sa procedure ma'am. Balik lang diri after 2 to 3 hours for result. So, pwede na ka mo ulit ma'am. Salamat ma'am.
Sige, ma'am. Thank you.
Thank you.
Anatomy demonstrated for AP projection of the hip. So the proximal 1/3 of the femur should be visualized along with the acetabulum, and the adjacent part of the pubis, ischium, and ilium. Any existing orthopedic appliance should be visible in entirety. So the greater trochanter and femoral head and neck should be in full profile without foreshortening. The lesser trochanter should not be project beyond the medial border of the femur. With some patients, only its very tip is seen, with sufficient internal rotation of leg. Minimal is seen or only the tip. So make sure to collimate field in which it can demonstrate the entire hip and any orthopedic appliance in its entirety. Collimation to area of interest, and collimate the four sides of the anatomy of interest. For the lateral or mediolateral hip, the anatomy demonstrated, we will see the lateral views of the acetabulum and the femoral head and neck, the trochanteric area, and proximal 1/3 of the femur are visible. Proper abduction of femur is demonstrated by femoral neck seen in profile, superimposed by greater trochanter. Proper centering is evidenced by femoral neck at center of collimated field. So collimate only the area of interest. Also collimate four sides of the anatomy.